Hi, good morning. My name is Jessica Altman. I am a leukemia physician at Northwestern University in Chicago, Illinois. And I'm here at the American Society of Hematology meeting 2019. I have been asked to talk about some things of note from this meeting. I think one of the potential areas of major interest at this meeting is that we have been able to have our first presentation and introduction to the ASH acute myeloid leukemia guidelines. The American Society of Hematology worked with researchers from McMaster University and a panel of leukemia physicians and folks interested in epidemiology and the gamut of entities involved in with the care of adults with acute leukemia to try to identify questions that require guideline recommendations. We've worked to develop a series of questions that there were really almost seemingly simple questions, but lacking of concrete data. And those questions allowed the synthesis and analysis, or analysis and synthesis of the medical literature. This medical literature was analyzed in great detail through a very rigorous mechanism with researchers from McMaster University. And then as we had the data, the panel members interpreted the data and have developed a series of recommendations. The questions span from items like, should adults who are candidates for intensive chemotherapy receive either intensive chemotherapy or a non-intensive chemotherapy, to questions of the role of transfusion support in adults who are no longer receiving anti-leukemic therapy. These questions are all geared towards the treatment of older adults. And I think what the most striking output that I received from working on this panel recommendation is the recognition that there is an incredible body of knowledge, and yet how many questions there are left to be answered and how many more studies we need to do to be able to truly crystallize a series of concrete recommendations. Despite that, the panel has developed a number of recommendations, and those recommendations are now open for public comment.